Good afternoon, everybody. Thanks for the organizers for inviting me to talk to you. So I'm taking a different tack today. We're just going to be a little bit more of a practical talk. So I'm a respiratory physician working in Beaumont Hospital, and with collaboration through colleagues in neurology, cardiology, and allied health, we provide a service for neuromuscular patients across the country. And I'm just going to focus in on some of the respiratory supports that we offer in the clinic that we run. So particularly for this talk, I don't have any disclosures. So this is what we're going to run through over the next 15 to 20 minutes or less, hopefully. We'll start with respiratory failure. So when patients come to our clinic, specifically for respiratory, the main reason is what support can we provide to help them with breathing or recurrent infections, for example. And one of the things that we assess for is whether the patients in that clinic are in respiratory failure, so their inability to do adequate gas exchange due to a multitude of reasons highlighted here. But a lot of the patients that come to this clinic are obviously due to the neuromuscular component of this infographic here. And this is kind of the cycle of errors that occur that lead to respiratory failure that make it worse as time goes on. So at each clinic appointment, we're assessing for some of the components that you see in this figure here, particularly symptoms, ability to gas exchange appropriately through measuring blood tests. But specifically in neuromuscular disease, this is kind of the evaluation or the evolution of respiratory failure in a neuromuscular disease, where you start with normal breathing, which you can, even with normal breathing, develop recurrent chest infections. And the big thing that we look out for are difficulties with breathing, particularly in sleep, when it exacerbates the situation much worse. And so it starts with REM or dream sleep related breathing disorders, and then a combination of REM or non-REM, and then more progressive disease, you get problems with respiration during wakeful hours. So when patients come to the clinic, we're trying to assess them for whether they need support through our services. And there are a lot of things that we go through in the clinic with myself and our allied health collaborators in the clinic. And the main thing we're looking for here are indications, contraindications, what patients are like, and then we go through equipment and then patient care subsequent to that if needed. The main indications for this type of support in our clinics is really to prevent patients with these conditions to develop decompensation, to alter their chest wall or lung growth characteristics as they age, to reduce the amount of recurrent chest infections, to rest their muscles while they sleep, which is when you're supposed to rest them, to control problems with ventilation again while you sleep, and then in more severe cases to treat people who have elevated carbon dioxide, which is a bad gas, during the day. And in some cases, we use it to help with other symptoms, to palliate symptoms such as chronic shortness of breath. For me, really, there is no real contraindications to starting patients on this support because the benefits really outweigh the risks associated with it. The only real contraindications in my mind, if someone is extremely unwell and needs more severe support as opposed to non-invasive ventilation, or if they can't wear a mask physically, then that might be a contraindication. But otherwise, there really isn't any contraindication in my mind. And what are the benefits? So I'm a very big supporter and proponent of using non-invasive ventilation for patients that require it, and therefore there are a lot of benefits in my mind. But simply put, the machine itself, and this is an example of one of the machines that we use in our clinic, provides support through different interfaces, which we'll talk about in a few minutes, but that helps eliminate that bad gas, carbon dioxide, improves shortness of breath in patients with chronic lung or neuromuscular conditions. So with routine use, you get all these advantages, right? You're less likely to come to the hospital, you're less likely to complain of shortness of breath, you have increased independence in your daily living because you have more energy, you're less short of breath, you have better quality of sleep, you're able to concentrate, and you have fewer headaches during the day, which is a consequence of having high carbon dioxide levels. And this is kind of a physiological map of what these devices do for patients who require them. So one thing is if your oxygen levels are low during the day or at nighttime, the support that these machines can give with or without oxygen can improve your oxygen levels. If you're very short of breath during the day and can't take very deep breaths in or out, the support from these machines will help you with ventilating, which have all these knockdown effects you see in green below, such as resting your muscles, as we talked about earlier. And then there's also an additional benefit that it provides cardiac support. So it's good for resting your heart and providing support to your heart from the pressures of the machine, which I won't go too much into specifics about. So when patients come to our clinic, this is the methods that we go through to assess needs for this sort of support. The image there is an example of pulmonary function testing, which we try and do before the patient comes to the clinic. So they'll get spirometry, which is where you take a big deep breath and a big breath out. And we do pressures to check your muscles' strength, whether it's through your mouth or through your nose. Of course, during the clinic assessment, we check for any symptoms such as shortness of breath, recurrent chest infections, extreme fatigue or tiredness, poor quality of sleep, early morning headaches, really bad nightmares. These are all signs to indicate that maybe you might need some support during your sleep. And the other thing that I try and do, at least at the first appointment in our clinic, is to check your gas exchange. And the way we do that is through a blood test, which is an arterial blood test, as labeled there. So once we've assessed you, and we might not be able to tell you directly at that clinic appointment, some of the tests need to be done as an outpatient and take a little bit of time. But once we've done the assessment and we decide maybe it would be worthwhile trying one of these devices with you, we then go through the equipment. One of the things that's important is that we need to make sure that you can protect your airway, that you're alert enough to do the machine or put the machine on, or that you have a sufficient support at home to provide this, that you don't have a lot of secretions, because if you imagine if you have a lot of secretions at night and you're putting on a mask with pressure, that's going to be difficult. And then we talk about likelihood of tolerating the machine and likelihood of deterioration without the machine. And then some of the devices, so I showed you an image of one of the ones that we use commonly in the clinic. Some of these are what we use in hospital, but also as an outpatient. These are some older models on the left there, and the newer models on the right. And then some of the newer machines that we're starting to get here, which we had in the States, but we're now starting to get here, provide multitude of options within one device. So this device on the right is a home ventilator, home suction device, high flow oxygen delivery device, as well as a cough assist, all in one machine. And as you can see from these images, these devices have become increasingly more portable. And then interfaces, so when we talk about interfaces, these are the type of masks that we use for patients. For me, generally, I usually try and start with a nasal mask because these are the most comfortable out of all the masks that we provide. And then depending on patient's preference and ability to tolerate the device, we go through the different masks. So this is the full face mask, and it can be full or it can be a partial full face mask. The advantage of this is that your mouth can be open, can be used with people who are a little bit more drowsy and who are more mouth breathers. But obviously it's a bigger mask and it can be a little bit more claustrophobic for patients. The nasal mask, as I said, is my initial go-to first starting mask. Allows patients to speak, can drink with the mask on, and is better for clearing of secretions as well. And then we have some newer hybrid masks, which include mouth as well as nose together. There's obviously with these devices, there's a lot of other additional equipment that needs to go with it, such as these tubings here, which can be short or long, depending on your distance from the machine, which have exhalation ports built into them. We have humidifiers for all the machines that we provide, and this is a comfort and patient decision, whether they like the air to be humidified or not. And then we have bacterial filters built into the devices as well. Other thing, obviously, with these masks, if you're wearing them for a long time and if there's high pressure on them, is to be aware of your skin. And so there are different devices to protect your skin from breakdown, but just be mindful of that when you're using these devices. So then we talk about setup. So once we decide, and this is a shared decision with the clinician, allied health, and the patient's family that NIV or non-invasive ventilation is the right treatment option for you. Through different vendors, the equipment is then delivered to your home, and the vendors will provide you with education about the machine, the setup of the machine, the settings of the machine, and they'll also go through all the different mask options that we just talked about there to see which is the most appropriate for you. Important thing that I tell all my patients when they come in, when they're about to start this, is that it's not easy. If you imagine sleeping with a mask on your face, first of all, it's going to be difficult, and then on top of that, a mask that's providing pressure while you're sleeping is going to be uncomfortable, to say the least. But it just takes time, and it takes quite a bit of effort. And sometimes I just say, just gradually do it. Even if it's during the day, put it on when you're watching TV or just chilling out at home, that you might just get used to the feeling of the pressure before you start wearing it at night, where it might be a little bit more claustrophobic. And the other thing is about caring for your machine. This is really important. I mean, most important thing about this is that you have to replace your mask every year, because the plastic and the rubber on the mask wears, and then you get a lot of leak, which is not comfortable. But on a daily basis, you should unplug and wipe down your machine to make sure that it's clean, and refill the humidifier water if you're using humidifier. And so then the last thing I'll just briefly touch on is the cough assist device, which is another support that we provide in our clinic. And this is heavily reliant on our allied health partners in physiotherapy, who are able to assess you for the need of this device and also provide you education and delivery of the device in your home if you need it. And obviously the cough maneuver that we know of is a little bit more complicated than this slide depicts, but essentially you're taking a big inspiration in, your glottis, which is what protects your lungs from spillage of content, closes, the pressure builds up in your chest cavity, then it opens, and then a big gust of high velocity air is released. And usually with that change in pressure, it clears some of the secretions that are stuck in your airways that you cough out. And so you need quite a bit of strength to provide a really good, effective cough. And if you can't, these are the benefits of coughing, right? That you clear that sputum, you prevent retention of sputum that can get infected or collapse in your lungs. It maintains strength, muscle strength of your thorax or your chest wall, and your cough reduces your hospital admissions and increases survival. But if you can't cough effectively, that sputum gets retained in your lower airways. It's more likely to get infected. Parts of your lung might collapse. When lungs collapse, you get more shorter breath, your oxygen levels drop. And so you're more likely to get infection, sepsis, respiratory failure, and or need to be in the hospital. So one of the things that we can do easily in the clinic to see how effective your cough is, well, obviously the easiest thing to do is just to get you to try and cough in the clinic and see how effective it is just from the bedside. But a more measurable way is to use a peak flow meter, which is adapted from what we do in the asthma clinic with a mouthpiece, where you try and cough into the device, and we do that 3 times just to see how good the flow of your cough is. And so once we do that, we might, depending on the measurements that we've seen with the cough peak flow, we might consider starting you or prescribing a cough assist device at home. And you see here in this slide here, I show some figures about the peak cough flow that we measure, but the other thing we do is we do spirometry, which I talked about earlier, which is a pulmonary function test that we measure at each of your clinic appointments. And so this is an example of a very old cough device, assist device that we don't really use anymore, but just to show you the evolution of the technology over time. This is one of the older devices. So what this does is that it increases your inspiratory volume and then increases your expiratory flow. And it just delivers this gradual positive pressure by a rapid shift into a negative pressure to stimulate a cough, or simulate a cough, sorry. And there are 2 modes that we use, and this is an example of a newer machine that we use. So there's automatic and there's manual. And automatic just triggers and cycles based on time that the user sets on the machine. And manual, you need someone to assist you with this. So you need a caregiver to change it from inspiration to expiration. But I usually recommend when you're starting on this device, because it takes a bit of getting used to the device, because there's big changes in pressure as you wear it, that you go with the manual mode first, just to get used to that feeling. There are different ways and different pressures that you can use when you're starting, which we would go through in the clinic. And then so once you've decided on that, you put the mask on yourself or on the patient, and you switch to inhale once they're ready. And then once the patient is ready to breathe out, that's when you, as the manual provider, press the exhale button, and then they should cough and secretions should come out with that. And once you do that, you're adjusting to the comfort of the patient, and you suction those clear secretions manually once they've coughed. And you do this 5 to 10 times, 2 to 3 times a day. The automatic mode is what you could potentially graduate onto once you feel comfortable in it. And there are different types of settings that we use for the automatic mode. So that was just a brief description of some of the services and supports that we provide in our pulmonary clinic for neuromuscular patients in Beaumont Hospital. So importantly, assessment for respiratory failure in neuromuscular disease is extremely important, as I'm sure I've highlighted to you there. Treatment with non-invasive ventilation support, as described in these slides, can help reduce symptoms and hospital presentation. Starting the device, I understand, can be extremely difficult, and it just takes a bit of time and attention to adjust to using the device, and we work very closely with our patients and the vendors that provide the machines to make sure we get the most comfortable fit for you. And in some patients, a cough assisted machine may be beneficial. And obviously, don't forget to continue doing all the other things that you guys do, which is really important, such as exercise and adequate nutrition. Thank you so much.